I'm going to be sharing 9 things that you didn't know about having a baby in the UK. Now, I'm a mom of 4 kids, and out of my 4, I had 3 of them in the UK and I had the other one in Nigeria. So I have the experience of both worlds. So this video, I'm going to be sharing with you the things that most people don't know, the things that a lot of people do not know about having a baby in the UK. Hi guys, welcome back to my channel. If this is your first time of seeing this beautiful face, my name is Precious. I'm a mom of 4 kids and I talk about family, relationship and lifestyle. I want to say thank you for stopping by to watch this video. If you haven't subscribed, please press the subscribe button, and as you're watching this video you enjoy it, you feel like this video is very exciting and full of information, please give me a thumbs up. If you really enjoyed this video, it makes me happy. And to all my returning subscribers, thank you so much. Now, living in the UK and having almost all of my babies in the UK, I can tell you there are a lot of things that people don't know. People don't know about having babies in the UK. But at the end of this video, you'll be able to know 9 solid things that you need to bear in mind if you're going to be having your babies in the UK. Now, one of the things you need to know is that in the UK or in England where I live, circumcision is not in the picture. So if you're going to be having a baby boy, you don't expect, like we do it in Nigeria, that after a couple of days you can get circumcised. Or circumcision is not a thing. They don't circumcise their babies here. The people who mostly circumcise are the black people like us, or the Asians, or the Jewish people. So you have to find places where they circumcise babies. In the UK, circumcision is more like a medical procedure. If there's something going on with your skin, your foreskin, they have to take it out. That's what most people do. But as a baby, circumcision is not a thing. So for us, obviously, there are like clinics that you have to book, which is not like, okay, NHS is doing circumcision, you can go and book. Even if they are doing, it's not going to be like the way you want it, where you want to have your baby circumcised in the few days where the few days after the baby was born. It's probably going to be months or maybe even years before your baby is circumcised, because there's going to be a waiting list or something. So circumcision is not a thing. So if you're coming to the UK and you're planning to have a baby boy, just know that you have to plan separately for circumcision. You have to just ask people around, black people, Asians, and they'll be able to point you to the right direction to circumcise your baby. What you need to bear in mind is that car seats in the UK is not just an essential, it's a necessity, okay? Car seats in the UK is not just an essential, it's a necessity. So if you're going to be having baby in the UK, you're going to have a car seat. In fact, you're not going to leave the hospital without having your car seat. They are going to make sure they are seeing your car seat. When it's time for you to be discharged, they want to see your car seat. They may not say it like, okay, go and get your car seat. They may not say it, but they are watching you. If there's no car seat, you're not going, you're not leaving the hospital. So you need to have a car seat before you leave the hospital. So car seat is not something you say, oh, you know what, we don't need a car seat, Jaria, we'll just hold the baby. No, it's actually a necessity. It's actually very essential. You can decide not to have a pram, which God knows why you should not have a pram anyway. But car seat, you need to have a car seat. Whether you have a car or you don't have a car, you're going to have a car seat. It's absolutely necessary, because you live in the hospital, the baby is going to go into the car. They're not looking at whether you have a car or not. They're looking at the safety of the baby. So for the baby to be transported from the hospital to the house, the baby is not going to fly. The baby needs to get into the car, and car seat is needed. Now, apart from you having a car seat, because one of the mistakes I have seen a lot of people make is that they buy a car seat, they move to the UK, they have a car seat, they don't practice how to use the car seat, they don't practice how to use the pram system, or in fact, not just car seat, everything that the baby needs that they are not used to. I would advise that when you buy a car seat, go and practice how to use it. Know how to use the strap, because that car seat will embarrass you. That car seat, you think that it's just a car seat. Now, it's not to put the baby and put it in. That car seat will embarrass you in public. So I would say that learn how to use your car seat when you get one, because it's very necessary and very essential. Another thing as well you need to bear in mind is that when you have a baby, your health visitor or the health visitor will visit you a lot. So if your house, if you live in a place where you think you don't want somebody to come to, you start thinking properly, because if health visitor is going to visit you, whether you're living in a cubicle, health visitor is coming there. Whether you're living in a mansion, health visitor is coming there. The health visitor is going to come to the house. This is just to make things a little bit comfortable for you. There's no need having a baby and you now start going back and forth. So they will visit you, I think, the next day you get home. They'll visit you, they visit you the day after. They'll visit you up to 4 to 5 times before they discharge you. They will only discharge you when they know that you're okay, the baby have settled in, you know how to breastfeed, they've watched you, the baby is also growing, putting on weight, and you are also fine in yourself in terms of bleeding and all of that. That's the only time they will discharge you. If they observe anything not right, they will refer you back to the hospital. You're going to go back to the hospital. I've seen a couple of my friends that the head visitor came and spotted something and they had to go back to the hospital. I've seen people where the head visitor come in and they find out that everything is fine and they just leave them. So who is the head visitor? A head visitor is either a nurse or a midwife or someone who is into health. I will just put it like that. That always looks after you and looks after your baby. So that's who a head visitor is. Another thing you need to know about having a baby in the UK is that you really don't need a hospital bag. So when I mean you really don't need a hospital bag, I don't mean that you should get pregnant and when it's time to have your baby, you should go to the hospital and not go with your hospital bag. No. What I mean is that in case of emergency, the hospital will sort you out. They will provide everything that your baby needs, including clothes. Yes. In fact, when I went to have a Naomi, they brought hats for me. It's not as if I didn't have hat, I had hats, but I think it was something that they give to everyone. As soon as, if you watch the green hats that Naomi had, I see if I can find a picture. The green hat that Naomi was wearing, it was from the hospital. It wasn't the one I bought. The one I bought was inside the bag. So they will provide everything. Just think about it. The reason they do this is because there are women that go into labor, if not at home. They're not with their hospital bag. So are they going to go back home and have their hospital bag go get their hospital bag before they go back to have their baby? No. And there are also women that become very, very unwell. So they will take care of you. Like they would look after you and your baby. In fact, if you're so lucky, there's some maternity ward that you go into that you wake up in the morning, the nurses, they will come and carry the baby from you. And just look after the baby until whenever you need the baby. They are so good like that, right? There is milk for the baby to take. There is bottle there is everything for the baby to start life with. After a couple of days, right, that's when they will now say, okay, by then at least your partner or somebody can come around and get the things that you couldn't get. So you don't really need all of that in case of emergency. So if you're thinking, oh, I'm pregnant now, I can have my baby anytime and I don't have my hospital bag, or I'm in labor, I don't have my hospital bag, there's no need going back home. Just go to the hospital and have your baby. They will sort you out. Then later you can go get your hospital bag. So in case of emergency, you don't need to sign. In the UK, life is paramount. Like when they bring someone in emergency, they're not looking for where's the husband, come and sign before we do the cesarean section, or where's the wife, or they use your hand. No, they're not doing that. Life is important, and that's why I love the NHS. That's why I work in the NHS. Like the NHS is one single thing that makes a lot of people come to the UK. The NHS is the National Health Service, is one single thing that makes a lot of people come to the UK, because when they are looking after you, they're not looking at how much they are spending. They're not looking at how much that drug is going to cost. They are looking at the best treatment for you. I know my friends in maybe Canada and America will be able to attest to this. If you go to Canada or you go to America and you have health insurance, they will give you options for treatment and it's based on your affordability. In the UK, options for treatment is not based on your affordability. Options for treatment is based on what is best for you, what is going to give you the best. That is what they do. And this is why I love the UK. This is why I always say, if you have the opportunity to move to the UK, if not for anything, for the NHS, do they make mistakes? Yes, every human being make mistakes, but they make human life paramount. So what I'm trying to say is that if, for example, they rush you into the hospital, they are not even asking who is the husband, who is the wife. They want to save your life, basically. They are ready to save your life. So in terms of signing signature, who is going to sign? No. They're not doing that. They're not doing that because every second counts. So the time you're going to be looking for who to sign signature, you may as well start saving your life. So that's one thing you need to bear in mind. So another thing as well is that when you're pregnant in the UK, right, you're entitled to free prescription. Now, if you don't know, prescription is being paid for, and I'm going to put in the cost on the screen. Prescription is being paid for. So if you go to the GP or you go to the doctor give you 5 medication to buy, you're going to pay for prescription. But when you're pregnant in the UK, you don't pay for prescription from when you got pregnant until 12 months after your baby was born. So until your baby is 1 year old. The same thing as well, you won't pay for dental care because you're entitled to free dental care. If you're pregnant, go and check your teeth. If you after you have your baby, go and check your teeth. Make sure you're looking after yourself very well. It is free. So because after that, you now start paying. So Naomi is 10 months old. Naomi is going to be 1 very soon. As soon as she turns 1, all my free prescription is gone. So they give you like a paper. You have a number, prescription number. I remember then with my other kids, they give you a card. But with Naomi, you just fill out the form and they give you like a PIN number or something. All you just need to do is when you go to the pharmacy, they ask you, are you do you require payment, or do you pay for your prescription? If you say no, you show them the prescription number or the number you have that is exempts you from paying for your prescription, and they will just write it down and they claim the money back from the government. So you don't pay for prescription, you don't pay for dental care in the UK from when you got pregnant until 12 months after your baby was born. Another thing you need to bear in mind is that being born in the UK does not mean that that baby is automatically a British citizen. It used to be before until some village people came and spoiled it. So in the US, yes, and I think some states, yes. In the UK, no. Having your baby in the UK does not guarantee that you're going to be a British citizen or a citizen of whatever country you are. Just bear that in mind. So if you're coming to have your baby in the UK, you're just having your baby in the UK. After having your baby is not a citizen. Your baby can always go back to whatever country you come from. So another thing as well you need to bear in mind is that as someone, if you're working in the UK and you get pregnant, you're entitled to 52 weeks holiday. Basically, you're entitled to 1 year of holiday, okay? But bear in mind that every employer is different. Some employers, they pay you for the whole 1 year, which I haven't seen, if I'm honest. But most employers pay you for 9 months or 6 months, okay? The remaining 3 months you're not going to be paid because it's voluntary, okay? So bear that in mind. Your entitlement when it comes to maternity leave is 52 weeks in the UK. Everyone is entitled to it provided you're working. And also what you need to bear in mind is that you need a red book. Every child born in the UK has a red book. I'm going to be putting a picture of a red book on the screen as well. Every child has a red book. The red book is like a record where they put everything about your child, the immunization, the growth, the weight, and everything about the child goes on that red book. So I have 4 red books in my house at the moment, and they are all kept safe because if anything, the health visitor, the doctors can always go back to it. Now, talking about red book, Naomi has just done her 10 months check. Okay, so the health visitor came to the house a few days ago and did a check, and I'm going to be making a video. If that video is not popping on the screen, I expect a video on Naomi's 10 months update. Don't miss that video because it's a lot. Don't miss that video. So yeah, so I have a red book for Naomi. So whenever the head visitor comes to the house, I show them the red book. They write what they need to write, just like one did the other time. They write everything so that it's like something that you keep record. Okay, in as much as everything on that red book is also in the system, they also have the physical record. So guys, these are the things, 9 things that you need to know about having a baby in the UK. Have you gotten value out of this video? Yes, I know you did. Please give me a thumbs up. Please give me a thumbs up. If you don't do anything in this video, please give me a thumbs up. Please, thank you so much. And also press the subscribe button if you haven't subscribed. Thank you so much for watching this video. If you have any question, like I always say, please ask us, as Precious is here to serve you, and Precious is going to be responding to that on the comment section. Thank you so much for watching. Be grateful, be positive, and be yourself. See you on my next video. Bye for now.